Hi everyone, welcome to NGR's 365 Family Nurse Practitioner Practical 1 oral debriefing on handout for definite diagnosis for a cognitive disorder. Today, the debriefing will be on a 28-year-old patient with complaint of recurrent painful genital ulcers that has lasted for 1 month. So in this debrief, I will explain data which supports the distinction of this patient's condition of HSV2. Rationale for this conclusion and evidence-based criteria. The patient has a history of genital lesion, localized pain of the painful genital ulcers, prior HSV2 diagnosis 3 years ago, which makes HSV diagnosis likely. Her lesions manifest as vesicles, a characteristic presentation of the HSV2 infection, especially with the knowledge that this patient experienced flare-ups in accordance with the stress, which is a non-activator for that leads to HSV outbreak. Polymerase chain reaction testing remains the diagnostic standard for HSV, given its high sensitivity and specificity, especially during symptoms outbreaks. For this patient, while diagnosis is established, performing a PCR test during an active outbreak could validate the diagnosis further and over viral load information, which can assist in treatment adjustment if needed. Serological testing for HSV2 antibodies is another option. However, its primary role is in confirming past infection rather than acute diagnosis, particularly in asymptomatic periods. So for treatment, I will recommend shifting from episodic therapy to daily suppressive antiviral therapy with valacyclovir, acyclovir, or pharmacyclovir. Daily suppressive therapy has been shown to significantly reduce both the frequency of symptomatic outbreaks and asymptomatic viral shedding, thus lowering the risk transmission. Specifically, valacyclovir at 500 mg daily is often preferred for its convenient dose and effectiveness, as studies demonstrate like 70 to 80% reduction in outbreak occurrence and a lowered rate of HSV2 acquisition. So another thing we shouldn't forget is also education. So educating the patient on HSV transmission dynamics is essential, particularly around asymptomatic viral shedding, which poses a risk for transmitting HSV even when symptoms are absent. We cannot also overemphasize the need for counseling, because counseling should also emphasize the importance of consistent condom use even when there are no visible symptoms, to reduce the risk of transmitting the virus to a partner. Additionally, discussing stress management strategies may benefit the patient, as psychological stress is a well-known trigger of HSV reactivation. This can help minimize recurrence and improve the quality of life. So in conclusion, I would say HSV2 is the definitive diagnosis, strongly supported by the patient's symptoms and past medical history. A shift to daily suppressive therapy combined with targeted education and transmission prevention and stress management offers a comprehensive approach to reducing outbreak frequency and managing the risk of transmission. So I hope and believe that this debriefing will go a long way in helping us to manage the HSV. Like I said, we have to continue educating the patient on the outbreak of the disease. Thank you so much.